Good morning, everybody. Thank you for being here. My name is Kulesza. I am a scholar in child health policy at Rice University's Baker Institute for Public Policy. At Rice University, I research the non-medical drivers of health in child populations. So understanding how things like food insecurity, childcare access, food insecurity impact the well-being and academic performance of children. And being at the Baker Institute is an absolutely wonderful experience because it's at a place like Baker where we are able to bring together the research and translate that into practical policy solutions and work with community stakeholders to really make a positive difference within the community. Wonderful, thank you. So today, we're going to be discussing childcare access within Harris County and how that relates to the workplace. In the United States, especially going back to the Second World War, benefits when it comes to healthcare, when it comes to childcare access, are intricately linked to your employment, right? It's something that was provided, especially as we were getting out of the Second World War, as a way for workers to be able to get certain benefits from their employers in lieu of wages or some other services. Because of course, in the United States, we don't really consider the natural place for some of this provision in terms of these benefits really to be surrounded by government policy, right? We typically look at a lot of these benefits and think, at least in terms of healthcare access, workplace. So we're going to be exploring what does childcare access look like? How does that relate to workplace well-being? And also, indeed, what that can look like in terms of our economy as a whole. So next slide, please. So for our agenda, the first thing I'd like to do is for us to actually discuss our thoughts about what early childcare access means and what are some of the challenges that we are seeing within Harris County overall. Then we're going to discuss the connection between workplace and early childcare access. So what does that relationship look like? Then we're going to be providing some information from a study that we conducted within the medical center. So we typically think that healthcare providers should be the most in tune in terms of understanding family needs and also being able to provide for their workers. But what you find is that even in a place like the healthcare profession, there's still quite a bit of a mismatch between what workers are expecting in terms of what they need for childcare and what the employers are actually providing. So I'm going to be providing some information from a study that we did that looks at some of the feedback we received from workers in the Texas Medical Center. And then we're going to end with a group conversation surrounding how employers may be able to improve early child care access within Harris County. So, starting off, want us to answer the question, what is most important to you concerning early child care access? So I'd like you to take 5 minutes to write your thoughts down. Feel free to share with others around you, and then we're going to discuss these themes in the larger group before we start talking about the connection between workplace and childcare access. All right, so let's bring it back in. All right, so what did we discuss? What did we say are some of the most important themes and topics? Would you like to share? Yeah, go right on ahead.
Thank you. And then when we're speaking, particularly for families who are marginalized, there has to be consideration for families who typically experience a lot of gaps or separation within their employment. So that's going to definitely tie into affordability. And I think lastly, we definitely touched on, why is it escaping me, Danielle? Yes, hours of operation. So again, especially considering marginalized families, they tend to work in non-traditional office settings that are outside of the 9 to 5 hours, and so we're needing to see evening care and weekend care as well.
Yeah, so excellent. So talking about affordability, talking about hours, non-traditional hours, right? So of course, not everybody works a 9 to 5 job. And what do you do? Because most of these childcare centers are really designed around the typical workday. And you bring up a very good point as well. So after employment, if something happens, a lot of these childcare centers are privately run, right? You don't have access if you as much access if you don't have a job, or if the child care center is directly linked to your workplace, right? You have an on-site center, then what do you do? You're having to find other arrangements, and some of these wait lists, depending on the area, can be 6 to 9 months, right? What do you do in cases like that? Very good. Anybody else like to share? Thank you for that. Anybody? Don't be shy. Or do we catch? Oh, right on. Yes, thank you.
It's for the
More
yes.
for the Zoom, yes.
Yes, hello, Zoom people. My name is Jasmine Castleberry. I'm with the Harris County Department of Education. My table mates and I talked about high quality care. And I think for me, when I think about, when you said there are more private child care centers. So I got my start in a private preschool, La Petite Academy back in the day. And they had this specialized curriculum that they purchased, right? And it was for all of their child care centers across the nation. It was through Scholastic. And so I think about these smaller child care centers who don't have that same access to a specialized curriculum. And so parents are often not afforded, or the kids are not afforded the same level of early education as some other, like Montessori schools, where you're paying a higher tuition rate for these, early child care centers and stuff like that. So it almost becomes a babysitting, I know we hate to hear that, type of atmosphere instead of early education.
Exactly. You bring up a really good point about curriculum, because there's a couple different things with that. One is, as you said, right, the quality. What can the child care center actually provide in terms of what their curriculum looks like based on the resources? But then there's another question too about, does the curriculum match the needs of the child? And how much access does the parent have to provide education in a manner or in a fashion that will meet the learning needs of the child based on where they are? So very, very good as well. Yes. Anybody else like to share? Right over here. Thank you.
Thank you. I'm Dr. Anna Burton from the Children's Learning Institute. And I think one of the big concerns is workforce development within early childhood professionals. So thinking about how we are training pre-service and in-service teachers to provide that high quality care and education.
No, that's very good. Thank you. Very, very good. Anybody else? Oh.
This is from one of our Zoom participants, Ms. Marisol. Most important to me concerning early child care access, parents might choose to keep their child at home and they miss out on an opportunity to develop fundamental skills at this age. Parents might not know how to access early child care for free.
Oh, very good. Absolutely. And that is really difficult to be able to figure out what is available and what location. We don't have necessarily always an easy place to get information for parents. We try, right? But it's difficult to communicate the resources to parents, and then some of these, depending on where you live, aren't necessarily the most accessible, and that can make it difficult for individuals or for families to link up their kids to childcare access. So very, very good. Anybody else before we move on? Okay, next slide. So let's take a look at what the overall highlights are in terms of the data with childcare access. So looking from the Annie E. Casey Foundation, there are 2.3 million children ages 5 and under in Texas. Of these children, 60% have all available parents in the workforce, meaning that in either dual family or dual parent households or single parent households, all of the adults in that household are working. So emphasizing this huge gap between, they're not able necessarily to use their workday, right, to be able to oversee their children during that time. So highlighting the lack of affordable and easily accessible childcare is indeed consistently giving concern among caregivers, right? Because how are then they able to meet their childcare needs with their workplace demands? Next slide. Okay. But as we discussed, childcare access is indeed becoming more expensive and it is becoming less accessible, right? Even since the COVID-19 pandemic, so during COVID-19, we saw a pretty significant decrease in the number of seats available for childcare, right? We had quite a few closures as the centers themselves were not able to meet their financial needs because of a lack of enrollment or drop of enrollment. Just now we're starting to see the number of seats increase, but with that, the market, of course, has some other issues. For one, the annual cost of infant care in Texas is over $9,000. For many working families, that is completely inaccessible, right? With the median wage for childcare workers being only $12, we also have problems regarding retention, right? We know that teachers, keeping them is extremely difficult. And that's even, we're talking about early childcare. I mean, that's now even true for all ages, right? Because there are so many demands on teachers from, the providing for the mental and physical health of their kids, and also having to do that with low pay in general. So that's creating a significant problem with wait lists. With many of the childcare centers that are available, there just simply aren't enough seats for parents to be able to get their child care needs met. Next slide, please. And with this, our access to childcare in the United States is intricately intertwined with our employment status, right? We do not have a publicly available universal system in all places throughout the United States, right? Kind of what I mentioned before, we don't typically immediately think in the United States that if there is a societal need that government is going to provide it, right? We're not quite like a system like in Scandinavia with the universalist systems or whatnot. We're much more free market based, right? So with that, your access is going to be linked to whether or not you have a job and what are the benefits that your employment gives. But on top of that too, what does your schedule look like? And even can your basic schedule then allow you to have the proper childcare access that you really need? So thinking about things like salary, PTO, is there on-site care, right? Is there a place that your workplace is actually providing for you to be able to drop your children off? Backup care, right? So if something happens, if your childcare center is closed, do you have something like a Bright Horizons that can then provide you with some kind of either in-home care or external care? Your scheduling, your backfillability. So in certain industries, you need to have somebody backing you up if you're not making it into work, right? You're a critical person. And if that critical person isn't there, you need to have somebody else. Well, if something happens at home and there's no backup, what do you do? How do you balance that out? We also have now dependent care flexible spending accounts, so whether or not you have access to that, and then of course subsidies. Okay. Next slide. So looking at the employer side, there seems to be a general acknowledgement from employers that childcare access is important for their workers, right? More than half of employers now say that they prioritize providing childcare benefits to their employees. So that's positive, and that's higher than it has been in years past. However, that does not mean that workers' needs are being met, and even that workers are able to properly balance their professional development with what's available to them. So 1 in 5 US workers have left their job because employers did not provide adequate care. That is a huge amount and really puts a lot of strain on families, especially in those families where all available adults are working, right? How then do you balance the financial needs of your family with childcare access? So companies are starting again to provide more benefits. Offering childcare benefits report an average out-of-pocket savings of $2,727, or about 15% of the annual cost of $18,000. So we're seeing a positive trajectory, but there's still a lot of work to do, and workers are still saying that they do indeed need more benefits and assistance. Next slide. So what are the impacts of the lack of childcare within the workplace? So of course, for one, professional development, right? People having to constantly think about whether or not they can be more, they need to be more at home, or whether or not they need to be in the workplace. Having a child, for example, having a baby, right? We in the United States do not have any kind of paid, guaranteed paid maternity or paternity leave, right? So what does that fall on? That usually falls on either your free benefit or your unpaid benefit, right? That's federally mandated, or whatever benefit your workplace is providing. So lack of childcare, as mentioned, absenteeism, a reduction in productivity, and burnout. We'll talk about burnout in a second. But these impacts are particularly felt by women in underrepresented populations, right? Because they're more likely to be the ones said that they are responsible for childcare in the household, right? There's a societal norm, right, that childcare traditionally falls on women. So they're more likely to report reduced hours, therefore leaving the workplace. Next slide. So burnout. Burnout is especially important to talk about when we speak about the stresses in the workplace. So thinking about these 3 things: emotional exhaustion, cynicism and depersonalization, and reduced professional efficiency and personal accomplishment. So as childcare becomes, as it becomes less accessible to certain populations and to certain workplaces, as it becomes more difficult, burnout is likely to increase, and that's going to have some real economic costs on both the person working, but also, of course, on the workplace itself, and leading to significant inefficiencies. Next slide, please. So with that, we did a case study of the Texas Medical Center to understand what did childcare access look like for healthcare professionals, right? So healthcare professionals very oftentimes have untraditional hours. They are required to be in long shifts, right? Shifts that oftentimes do not match up with the access of childcare centers, right? But at the same time, too, we're thinking about healthcare providers. Typically, you'd think that they'd be the most in tune with the needs for childcare development, right? These are the people that we take our kids to, right? If they have a condition, if they have an issue, they're the ones we go to for help. So we wanted to know, were they really meeting the needs of their workers? So within the Texas Medical Center, right, we have over 54 institutions and employs over 120,000 workers. But interestingly enough, and when we did this study, it was 0. But there is only 1 institution that supports an on-site center. Only 1. Previously, it was 0, and then when we were writing the manuscript, we found that, oh, one had just recently opened this year. So there is one now. And there used to only be one, and it got closed down during COVID-19 due to financial strain. Next slide. So we conducted a mixed method survey. So we sent out surveys online to ask parents, what does their childcare access look like, and what are their priorities? What are they most interested in having? And what was their workplace actually providing? Okay? Wanted to understand those barriers, employment challenges, and we yielded altogether 408 responses. Okay? And then we held 4 semi-structured focus groups of TMC employees and students from December 2023 to January 2024 to really get a deeper understanding about what they're going through. So the quantitative data gave us a really good aggregate, but we really wanted to understand the stories of what people were facing, right? To really get into that context that a survey would really not necessarily give us that information about. Next slide. So the reason why we were so interested in healthcare was, think about the Harris County economy, right? When you think of the Harris County economy, what industries do you think of? Anybody? Oil, gas, right? What else? Medicine, manufacturing. So we typically think healthcare is usually, right? Medicine is up there, right? Healthcare delivery is up there. And indeed, if you look at the breakdown, it indeed does make up a pretty significant proportion of the Harris County economy. So tackling this issue is vitally important for the Harris County economy, because if we have workers facing burnout, if we have workers that are not able to get their child care needs met, and that's impacting the family, that's going to impact our overall economic performance. And that's going to reduce our well-being, when indeed healthcare is supposed to be a big thing about Harris County. Well-being is supposed to be one of the things that is driving even what we do as an economy. Next slide. Okay. So looking at the survey data here, so most parents rely on child care centers or preschool programs, while 26% use non-relatives or relatives, and a smaller proportion depend on parents or their spouses, right? So looking here at our sample population, mostly they were using child care centers, right? Or using some form of preschool program. Look at these costs. About 75% of parents reported that they pay over $1,000 a month. That is huge. That's a lot, a very significant proportion of income. And 35% paid more than $1,800 a month. So not only are there fewer seats, of course, but once you get the seat, you're spending a lot of money, right? And then location. So we spoke a little bit about location earlier. 64% of parents have childcare arrangements that are within 5 miles of their home, and 24% travel 6 to 10 miles, and 9% travel 11 to 25 miles. So with that said, the child care centers tend to be relatively close to home, or relatively close to home. They tend to prioritize childcare that's closer to home rather than the workplace, which we'll see in a little bit more detail in a second. Next slide, please. So looking at the priority survey results, so this was breaking it down as a Likert scale, asking what are their priorities based on it being not at all important all the way to extremely important, okay? So looking at close to where I live, important, close to where I work, pretty important, but look at safety. Safety was a huge one, and we know from, unfortunately, from the news and from also some reports coming from law enforcement, unfortunately, threats against educational facilities is increasing with time. It is a really sad reality that it's becoming more concerning that we can't keep our children safe in their child care centers. So safety is very high. Education, of course, diversity, but price was a bit lower than we expected in terms of a priority. And when we look at the qualitative data, you'll see that price does come up, but part of this seems to be that, for one, there really wasn't that much that was accessible anyway that would be low cost. But two, parents are willing to put their children into a good quality center, even if it costs more, because they want to make sure that their kids are really learning, okay? Religion, we found, was not very important at all. That was our least important in terms of the priorities. And then, of course, whether or not children can socialize. So whether or not they have that ability to form bonds and really learn those social skills. Next slide, please. Okay. Then looking at current conditions. So we asked, what did they prioritize? But then what were their perceptions of their current child care center? Okay. So indeed close to where I live. So that was more important, and that is indeed what they were doing. They were more likely to put their kids into a child care center that was close to where they live rather than where they worked, okay? But they did feel that their child care center or their arrangements prioritize education, prioritize safety. Again, not much very religious, but also uses an appropriate curriculum and is state certified and can socialize. So among this sample population, they did show that they were relatively happy with their childcare arrangements, and they did feel that they were getting good education, even though it was very expensive. Next slide, please. Okay. So when it came to the qualitative study, there were 4 different things that we really wanted to understand when we interviewed the students and the parents. So understanding barriers to access, priorities, perceptions, and opportunities, and understanding whether or not some things that were from our survey could be further contextualized, right? So that we could really understand and get that story from our parents and our students. Go ahead. From our parents, rather. Next slide. Okay. So these are some of the quotes directly from our participants. No names, of course, but so talking about barriers to access, one of the parents said, I think there's no affordable option. If you ask me in the medical center, call a couple places around, they'll make it drive it close by, and they're like $1,900 to $2,000 a month, which is not doable on a regular salary. So again, seeing this, it is unaffordable and it's inaccessible. Priorities, think it's important for us, since whether it be close to home or close to work on the way, even though I can be flexible, a lot of the time it needs to be somewhat convenient, otherwise what's the point? So we see, as we noted earlier, that there's no on-site care. And what's there is expensive, but they still need something that's going to be convenient for them, right? Perception, so we had a nanny up until a month ago. Then we switched my kid to this Montessori school, museum district, and it's been honestly like one of the hardest months so far of having a kid. My kid has been sick just like constantly over the past month. Changing childcare can be a challenge if your arrangements change, right? Your child needs to now socialize with other children. They get, unfortunately, other illnesses and sicknesses. You know, I think my 14-month-old daughter has now been sick for 2 months straight, and my 4-year-old at one point was sick for 6 months straight because he just kept getting virus after virus, right? And then the first, looking at opportunities, the first thing I imagine is going to be impossible to get there because everybody's going to want to use it. This is talking about the on-site center. It's either going to be some huge institution that actually can serve everybody, or it's going to be impossible to get on the waiting list. But that's to say, yeah, that would have been amazing. So recognizing that, yes, things like on-site care can be important, but a concern that it's going to be too long of a wait list, too expensive, and with the number of kids there, it might be an issue in terms of the curriculum development. Okay, next slide. Okay. So some recommendations from our findings, okay? So childcare infrastructure needs to be considered a critical factor in the way that it relates to our workforce and the way that it relates to our overall economy within Harris County. On-site childcare provision can be helpful for healthcare workers, but it needs to be affordable and accessible. And we really need to focus on improving educator retention, right? So as mentioned earlier that, teachers are, early child care teachers are making very little and we have a very high rate of turnover. That's going to impact the educational outcomes of our children, right? So, next slide. So, what I would like you to do for like 1 minute, and we'll do a quick share and then we'll finish up. What do you think employers can do to improve early child care access? I'd like you to quickly answer this and then we'll come back and we'll close out with your answers. We come up with? What can... I promise you I did not incorporate that into the slide. That was not my intention. I did not do that. I'll give, yes, give my, so with that said, anybody like to share? What can employers do? Really quickly. Oh, in back. Oh, oh.
I gotta read. Oh, and then hi, my name is. Hi, y'all. So anyway, I said I thought maybe like for healthcare, an on-site facility where you can drop your babies off, and just go and work your job, your shift, your 12-hour shift. And like Miss Mercedes said, you can probably drop in and eat a little lunch with your baby on your lunch break, or you're already at the hospital. If they sick, you can go take them to the ER. So it would be perfect. Just have your own little hub right there.
Absolutely, yes. So on-site, an endorsement for on-site. Who else would like to share? Oh, right over here.
So maybe in addition to having on-site facilities, maybe organizations can partner with their local childcare facilities, like in their neighborhood or community. So partner with them, maybe work out some discounted rates, or invest in them, sponsor them, provide grants to the childcare facility to really up their game in terms of quality, or maybe even possibly pay their workers more.
Yeah, that's a really good idea. Yes. Would, over here? Oh. We'll do one more and we'll close out.
I love that. Yeah, if they could just pay their employees more, that would be a great service to everyone. Danielle and I also discussed, ideally, in a perfect world, right, we would have universal care, or universal early education, but as different priorities either reach that destination or not. But we also discussed that it would be great to see an addition of or increase in cross-sector partnerships. We're starting to see a lot of cross-sector partnerships take place where large corporations or businesses, they have a lot of buy-in and direct conversations with community members, including child care agencies. One of the things we discussed was organizations having direct connections and close conversations routinely or consistently with child care referral agencies or CCRAs, so that they're well versed in the different availabilities of childcare, because as your survey showed, that some families may prefer family members or FFN, family, friends, neighbor, or they may prefer preschool settings. So it's diverse based on that family's needs.
Excellent, thank you. All right, well, thank you everybody for listening. I really appreciate it. If you have any questions or thoughts, feedback, please, of course, always feel free to communicate those with me. Love to get in touch, and thank you for the invitation for speaking today.